Hi everyone and welcome back to Lori Medicare Essentials. In this video, we're taking a closer look at Medicare Part D. We'll talk about what it is, how it works, what costs beneficiaries might face while using it, and the key things that every agent should understand to better serve their clients. Medicare Part D is the part of Medicare that covers prescription drugs. It was created to help Medicare beneficiaries easily get their prescriptions and lower their out-of-pocket costs at the pharmacy. Part D plans are offered by private insurance companies that are approved by Medicare. They help pay for both generic and brand name medications, but it is important to note that Part D is optional. If someone goes without it when they're first eligible and doesn't have other creditable drug coverage, they may face a late enrollment penalty if they sign up later. Just so you know, the late enrollment penalty is 1% of the national average times however many months they didn't have coverage, and unfortunately, this penalty is for life. Now that you know what Medicare Part D is, let's talk about how the plans actually work. Part D plans are built around a standard model designed by Medicare. Each individual insurance company, though, can adjust the details to be better than the standard model to attract more membership, like premiums, deductibles, and copays. These adjustments also have to stay within certain guidelines. Most plans follow this basic structure. They have an annual deductible, which is the amount a member has to pay out of pocket before the plan begins to share in the cost. Some plans waive this deductible for lower tier drugs. Most plans have copays and coinsurance at the pharmacy while members pick up their medications. These costs can vary depending on the drug's tier and by plan. And all plans now use a tiered formulary, which is a list of covered drugs organized into different levels. Each tier has a different cost level for the member. Once again, the formulary and the tiers medications fall on can vary by plan. Here's a typical example of the tiers and how they are structured. Tier 1s are normally preferred generics. They'll have your lowest copay at the pharmacy. Tier 2 are non-preferred generics. They'll still be pretty low out-of-pocket costs, but will be more than Tier 1. Tier 3 is when we get into brand name drugs. These are going to be your lowest cost brand name drugs, and typically the member will pay a percentage of the retail cost or a set copayment depending on the plan. Tier 4 and Tier 5 drugs are going to be your higher cost brand name, and then your specialty medications, which are going to have the highest cost to the member and the highest cost to the plan. While the structure is standardized, each plan's formulary or list of covered medications can vary pretty widely, so it's important to review your client's medications to ensure they are all covered by the plan and your client knows exactly what to expect to pay at the pharmacy when they pick up their meds. There's nothing worse than getting a call from an angry client having to pay more than expected, so make sure they understand their medication cost and what's covered before enrolling them in coverage. Another important feature of Part D plans that all insurance companies use is something called utilization management. This refers to the tools insurance companies use to help control costs and ensure medications are used safely and effectively. There are three main types of utilization management techniques. The first is prior authorizations. The plan typically requires prior approval for certain medications. These are usually higher cost medications, and they want to make sure that it's medically necessary and the beneficiary fits the criteria for that medication before they pay for it. The next is step therapy. This means the client may need to try a lower cost drug first before stepping up to a more expensive option. The insurance company here is making sure there's not a lower cost solution before they pay for a multi-$1,000 drug. Finally, we have quantity limits. This is how the plan limits how much of a drug a person can get at one time. This is typically based on safety or cost guidelines, and usually these are safety things, not necessarily trying to keep costs low, but trying to keep consumers safe. As an agent, it's really important to let clients know that these rules exist so that they are not caught off guard when filling a prescription. You will learn, if you haven't seen already, that setting proper expectations when it comes to someone's Part D coverage is the most important thing that you can do as an agent. Finally, let's talk about how Medicare beneficiaries enroll in Part D coverage. To be eligible, a person must be enrolled in Medicare Parts A and or B, and in most cases, they're going to be enrolled in both as they need hospital and medical coverage. Once they meet this minimum requirement, there are two main ways they can get coverage for Part D. The first option is to enroll in a standalone Part D plan, also called a PDP. This is the most common choice for people who are on original Medicare and have a Medicare supplement plan to help with their out-of-pocket costs on the hospital and medical side of things. If you want to learn more about how Medicare supplement plans work, go ahead and click the card in the upper left-hand corner of your screen for a full breakdown video similar to this. The second option to get prescription coverage is going to be through a Medicare Advantage plan that includes prescription drugs. These are known as MAPD plans, and they bundle together Hospital Part A, Medical Part B, and usually Prescription Part D all into one plan managed by a private insurance company. If you're curious about how Medicare Advantage plans work and if they're a good fit for your clients, click the card in the upper right-hand corner of your screen to watch a full breakdown. Whether it's a standalone Part D plan or drug coverage through a Medicare Advantage plan, the most important thing is to make sure your client's medications are covered by the plan, they understand the costs that they will experience at the pharmacy, and they know the rules in which to get certain medications filled. You never want to leave a client guessing, and you want to always set proper expectations so they know how to make the best choice for their prescription coverage. Before you go, here are 4 key takeaways about Medicare Part D. The first is Part D plans help cover prescription drug costs, and they are offered through private insurance companies that are approved by Medicare. Second, Part D plans follow a standard model, although carriers can make their plans better than the standard model to attract more membership if they want to. The standard model includes a set annual deductible, copays and coinsurance at the pharmacy, and a tiered formulary system that determines how much clients pay for different types of medications when they get them filled. Thirdly, many plans use utilization management tools like prior authorizations, step therapy, and quantity limits to help manage costs and ensure medications are used safely and appropriately. This ensures that premiums remain low for years to come while benefits stay high. Fourth, beneficiaries must be enrolled in Medicare Parts A and or B to qualify to enroll in a Part D plan. They can also get coverage through a standalone Part D, also known as a PDP, or a Medicare Advantage plan with prescription drug coverage, also known as an MAPD. Once again, it is vital to set proper expectations with your clients and to check which medications are covered by the plan before ever enrolling them in coverage. You want clients to know what they're going to pay when they go to get their medications filled at the pharmacy, so that they are empowered to make the best coverage decision possible when it comes to their prescriptions.